My name is Priscilla Gates and I'm the autologous bone marrow transplant survivorship nurse consultant at the Olivia Newton-John Cancer and Wellness Centre. The title of my presentation today is a scoping project to evaluate the unmet needs of 50 patients attending a haematology nurse-led survivorship clinic. This clinic commenced in April 2014. It started off as an ad hoc clinic, presented and delivered in Clinic 6, but is now a weekly clinic held on Thursday afternoons in the Wellness Centre at the ONJ Centre. To date, over 75 patients have attended the clinic. The eligibility for the clinic is those patients who've received treatment for haematological malignancy with intent for cure or long-term remission. From previous research that I have undertaken and also well documented in the literature, we recommend that patients attend around the 3 to 4 month mark post-treatment completion to facilitate early intervention. All patients prior to attending the clinic are invited to complete a set of questionnaires. This includes the Cancer Survivors Unmet Needs Questionnaire, the Distress Screening Thermometer and Problem Checklist, the Healthy Lifestyle Questionnaire, and demographic data is also collected. We were very privileged last year that in May 2015 we received Scoping Project Grant from NIMIX to report on the first 50 patients attending the clinic between April 2014 and June 2015, and I'd like to give you a snapshot of that data now. The majority of patients attending the clinic were male. The median age at clinic attendance was 48. Majority of patients had had a diagnosis of lymphoma followed by myeloma. All patients had received chemotherapy, and as part of my role as the autologous bone marrow transplant coordinator, 40% of patients attending the clinic had previously had an autograft. And the median age at attendance at the clinic post-treatment completion was 4 months. On the distress thermometer and problem checklist, more than half of patients documented a score of over 4 out of 10. The median distress score was 4 out of 10 for this patient group. It is well documented in the literature that patients receiving a score over 4 out of 10 require dedicated follow-up and referral pathways put in place. The main emotional problems documented were worry, followed by fear, mainly around fear of cancer recurrence. And the physical problems were fatigue, closely followed by memory and concentration problems. Patients also completed the Cancer Survivors Unmet Needs Survey, and my data here is presenting those who documented a moderate to very high unmet need. 60% of patients documented fatigue, 56% of patients found someone to talk to as difficult, nearly half had ongoing fear of cancer recurrence, 42% were depressed, and 40% found it very difficult being a high unmet need of dealing with a bad memory or lack of focus. On the Healthy Lifestyle Behaviour Questionnaire, the score instructions documented that a score below or equal to 30 indicates that patients are living with health risks, in particular leading on to cardiovascular disease, cancer and other chronic diseases. Of concern, 64% of patients attending the clinic documented a score of equal to or less than 30. And this was looking at the domains of weight, diet, activity, smoking and sun-smart behaviours. These unhealthy lifestyle behaviours resulted in 20% of patients being overweight and 22% of patients being obese who attended the clinic. A major component of the haematology nurse-led clinic was putting referral pathways in place, was really identifying the unmet needs that these patients were experiencing and supporting these patients with adequate referrals to other healthcare professionals. All patients were referred to the Olivia Newton-John Cancer Wellness Centre for the unique programs that they offer. 66% attended the Live Well program through the ONJ Centre, which is a 4-week goal-setting program that assists patients with adjusting to life after cancer, with a real focus on healthy eating, physical activity and emotional health. Community organisations were well utilised, particularly Cancer Council and Leukaemia Foundation, dietitian, psychology, GP, sexual health and menopause after cancer clinic, and one patient was referred to a dedicated cancer rehabilitation program on the peninsula. The recommendations that have come from our data analysis have shown a high level of patients, or high number of patients who have documented their level of distress as 4 or above. We plan in the future, through future funding opportunities, that these patients will be reassessed in the nurse-led haematology clinic, with the view being 3 months post. This will enable us to reassess the patient, assess their level of distress, and hopefully see an improvement as a result of the impact of the intervention and an improvement in recovery. We've also demonstrated high level in a cognitive functioning deficit, with 43% of patients documenting this. This is quite novel data, particularly in patients with haematological malignancies and post-bone marrow transplant. We've prioritised plans to implement and evaluate a formal cognitive rehabilitation program that can be implemented in the home setting for patients post-stem cell transplant. Thank you very much for the opportunity to present this data.